Welcome to Continuing Mobile Education for Emergency Medical Services Providers. This is Polypharmacy Episode 4, He Took How Many? Recognizing Medication Toxicity. Participants will recognize the common signs of medication toxicity, they will recognize the most common drug interactions and their effects in the pre-hospital settings, and review basic treatment for drug overdose.
Case in particular was a chronic pain patient who had accidentally overdosed on sustained-release morphine, and pre-hospital EMS gave a full 2 milligrams of naloxone instead of titrating to an effect, which led the patient to go into an acute withdrawal syndrome, which wound up going back and forth between possibly getting more opiates, supportive care, something that really could have been prevented with a little bit less aggressive treatment. But for the most part, EMS has done a pretty good job of recognizing and assessing the situation.
I would say my biggest concern is really the over-the-counter medications. Certainly prescribed medications from physicians can certainly cause harm as well in specific dosages and those with side effects, but oftentimes I think patients don't have adequate information about what risks are there to medications that they can buy over the counter at the local drugstore or the grocery store even. In particular, I'm concerned about medications that contain diphenhydramine or Benadryl. These are medications that are often in combinations with pain relievers or cold and allergy medications that there's a perception is overall that it's safe, and for many patients it is. But my concern is those patients that are older, that have multiple medical conditions and have a greater susceptibility to some of these side effects. It can very rapidly, even within just the first or second dose, precipitate altered mental status, confusion, can contribute to falls, urinary retention, a lot of other problems that certainly then will necessitate services of EMS personnel and may even result in hospitalization, and has been linked to bad outcomes for these patients. Increases their likelihood of falls and fractures and even death. So it's something I'm concerned about, that oftentimes it's not under the direct scope or supervision of a physician, but oftentimes patients are taking that into their own hands and taking medications without maybe not properly consulting with the pharmacist or the physician to be able to know what the risks are.
Pay attention to over-the-counter medications in the pharmaceutical history. Be aware of their common medications and their side effects in the older adult, and remember that patients often take their medications incorrectly.
I think many of us have had circumstances where we've taken care of patients that have either overdosed or inadvertently taken too many of one medication, or have had medication interactions. I think that's probably a tremendous underestimation of how often it really happens. So I think we probably don't recognize it even more. And I think probably the most common ones are things like certain antibiotics and other medications, for example, digoxin or warfarin, where those interact to cause elevated levels and so forth. Again, different types of narcotics and certain types of and cardiac medications. There are significant interactions with those if you're not careful, and that typically relates to rhythm disturbances, altered mental status, lots of things.
For patients that are experiencing an adverse drug event, it can range from anything that we would think of as a mild reaction. It may be something as simple as a rash or some stomach upset and those sorts of symptoms. But the thing we get concerned about is really a change in mental status and altered mental status. So the patient could be presenting with acute onset of confusion. They may be restless, disoriented, not making sense. It can affect their speech, their stability in terms of them just walking. We talk about their gait as being unstable. All these things can certainly argue for signs or symptoms of potential drug toxicity or an adverse event. And then we have to think about, for some specific drugs or medications, there may be an adverse event that may be just a consequence of the medication itself. for instance, blood pressure medications at an inappropriate dose or maybe too high of a dose for a patient that could precipitate a very rapid drop in blood pressure. So the patient may present with unconsciousness or a fall as the initial presentation. But again, I would consider that as being an adverse effect of some of these medications.
I think some of the key things, whether it be mental status changes, whether it be falls, whether it be delirium, from a cardiovascular standpoint, it could be hypotension, bradycardia, tachycardia. From an opioid standpoint, again, that CNS depression, respiratory depression. Remember, we're meant to treat the patient, not the condition.
Signs of medication toxicity include altered mental status, rash, abnormal vital signs, and exaggerated drug effect.
I think so. I think as we get older, it requires less medication to achieve desired effect, whether it be with antiemetics, anticholinergics, narcotics, etc. And one of my pearls of wisdom whenever I teach is that we can always give more. We can't take it away. And one dose doesn't necessarily fit all. And that person who may get too much oxycodone, say they had a Percocet prescription and they started off with 2 tablets every 4 hours, which might be relatively acceptable for you or I, but is going to be way too much for an older patient, is definitely going to experience narcosis a lot easier than you or I. The Benadryl that I mentioned earlier, the 25 milligrams that you or I take to go to sleep, may be 4-fold too much for somebody at home to go to sleep, and then they may wake up X amount of time later, etc., etc.
Some common drugs to watch out for are diphenhydramine, or Benadryl, Coumadin, digoxin, opiates, benzodiazepines, and remember to always be aware of potential drug interactions.
When you're examining a patient where you have a high suspicion for an adverse drug event or a complication of taking that medication, obviously we start with our ABCs and move from there. We manage the life-threatening conditions first. The history, again, is the most critical part of that, is determining what medications are there, and that's, again, where the pre-hospital professional is important in determining what else was at the scene, what other pills, what other non-medication agents were there. Was there tons of ginkgo there? Were there tons of multivitamins? Was there tons of iron or vitamin C, or what other things that could have caused this disturbance? Or Tylenol, ibuprofen, other over-the-counter medications that can have significant impact in that. And with that, become familiar with those medications and the common ones and what their side effects are. So beta blockers, too much of it, their heart rate slows down, for example.
I think EMS personnel plays a vital role, again, in screening for potential adverse effects of these medications. When we think about assessing the patient in the home and their pill-taking strategies, what medications are being taken, what are not being taken at that point, and really a very clear report of what are the acute onset symptoms for a patient. All this information can be rapidly obtained by EMS within the home, and that information becomes critical then to subsequent providers that are going to be caring for the patient. I oftentimes see the EMS personnel as really the eyes and ears in the field. They're able to quickly assess what the situation in the home environment is for this patient and be able to identify that there may be some difficulties in terms of taking medications, or maybe the medications are taken at inappropriate frequency or dosage. And then certainly if that fits with a clinical picture of an altered mental status or acute onset of confusion, then that certainly lends some evidence to the fact that it could be an adverse drug reaction, could be polypharmacy that's really at play here.
By the end of this episode, you should be able to recognize the common signs of medication toxicity, recognize the most common drug interactions and their effects in the pre-hospital setting, and review the basic steps for pre-hospital treatment of drug overdose.